All right, the Split the Pot lottery supports 71 hospitals across this province. This morning, our Nicole Servinas is live at the Mackenzie Richmond Hill Hospital, finding out how these donations can help change lives, support patients directly, and also help advance healthcare across Ontario. Hey, Nicole, good morning.
Hey, good morning. Absolutely, we're here in Richmond Hill at Mackenzie Health this morning. And like you said, Split the Pot really supports hospitals across Ontario, almost 71 hospitals. And again, all those proceeds really help out and make a huge difference. So that's why we're here today at Mackenzie Health, Richmond Hill Hospital. And it actually has a close place in my heart because I'm born and raised in Richmond Hill. So I'm going to invite the CEO and president over here, Nicole McCann. It's lovely to see you. Good morning.
Good to see you too.
So tell me about Mackenzie Health.
So Mackenzie Health Foundation is the fundraising arm for Mackenzie Health, which includes Cordalucci-Vaughan Hospital, which opened in 2021 as the first net new hospital in the province and the first smart hospital in Canada. And today we're at the Mackenzie Richmond Hill site, which has been serving the community for over 60 years. Yeah. So welcome.
Thank you. Like I said, I have many experiences, positive, and it really is a staple in the community. So tell me a little bit about what Mackenzie Richmond Hill Hospital is kind of known for.
So both our hospitals, Cordalucci-Vaughan and Mackenzie Richmond Hill, provide core services, so like emergency, surgical, diagnostic imaging. But each have some distinct programs, specialty programs that they offer. And so at Mackenzie Richmond Hill, most of our outpatient programs, ambulatory care programs, are offered here, as well as our regional chronic disease, kidney disease and dialysis, and our rehabilitation. And so I think you'll have the opportunity a little bit later this morning to visit with some of my esteemed colleagues and physicians to get a sneak peek at some of those areas and the services and programs and the equipment that comes from the generosity of our community.
Yeah, so let's talk about the community for a little bit, because the government does support healthcare, we know that, but it doesn't cover everything. So what exactly does Split the Pot and those funds and proceeds go towards, and what does it mean to Mackenzie Health?
So absolutely, philanthropy plays a critically important role in funding equipment and technology within our hospitals. And while the government funds a significant portion that includes operations and infrastructure, it isn't without the generosity of our community and philanthropy, because equipment and technology, as I said, is unfunded. And so it really does make the difference between a good hospital and a great hospital.
For sure. And what about patient care? Because a lot of it, when you walk into a hospital, that also makes a huge difference in an experience and the kind of care and treatment that someone's receiving.
Yeah, well, it all starts with the people. So it's the people that are delivering that care, but being able to provide those state-of-the-art, high-quality pieces of equipment and technology to our physicians and frontline staff is critically important to be able to deliver that high-quality healthcare close to home. And so it is essential.
It is essential. Yeah. Again, you can buy your tickets at splitthepot.ca. The early bird deadline is tonight, so you definitely want to purchase. Go online, check it out. Again, it covers, and you can decide where you want to put your money, right?
So as you mentioned earlier, it supports 70 hospitals across the province. You can choose to support all 70, or you can designate to a specific hospital. Of course, we would love it if you purchase and support Mackenzie Health. Mm-hmm. We had a lucky winner in our catchment area, so your odds are great.
There you go.
Just last week.
Okay.
And the early bird deadline for the next draw is tonight. So get your tickets at www.splitthepot.ca.
That's fantastic. And then Nicole, on a personal note, you've been with Mackenzie Health for a bit. What has been your relationship to the foundation and the two hospitals, Cordalucci and Richmond Hill?
Yeah, so I'm the president and CEO. I've lived in the catchment area for over 8 years, so I watched Cordalucci-Vaughan being built.
Which is amazing.
And I live in Richmond Hill now, so this is my community hospital, and so on a personal note, it is my community hospital, but also professionally, it's inspiring to see the community step up, the legacy that we have here within the community, and the role that our generous community plays in supporting our hospital.
That's fantastic. Yeah. Well, thanks for having us today,
and I can't wait to
continue our tour and to meet some of your esteemed colleagues as well. Don't forget, you can get your tickets at splitthepot.ca. We'll remind you all morning long. No worries, but lots more when we come back. Good morning, everyone. You're watching CP24 Breakfast. Now, Split the Pot Lottery partners with over 71 hospitals from across Ontario. And again, not only are you supporting 71 hospitals, but you're also supporting healthcare. We're at Mackenzie Health this morning in Richmond Hill, and I'm going to invite the Chief Department of Medicine at Mackenzie Health, Dr. Katarina Plank. It's lovely to be with you. Good morning.
Thank you for having me.
So, Dr. Katarina, tell me what area of the hospital we're in this morning.
So we're currently in the oncology clinic. We're standing in the treatment area, which is where patients would be receiving chemotherapy as part of their cancer journey. And our clinic has grown just like our region. And as you know, we went from a 1 to a 2 hospital system. As such, our oncology volumes have increased substantially by about 30%. And still all that significant and all that care is consolidated here at the Mackenzie Richmond Hill site, where patients come in, get their consultations, their diagnosis, and their treatment, and their entire journey. Their cancer journey really happens here in this clinic. So it's a very important part of our hospital.
Absolutely. Tell me a little bit about the program that you have in place to support patients who are diagnosed.
Right. So we have patients would come here with multiple cancer diagnoses. We have a group of oncologists and hematologists who are highly trained, who will see the patients, but then really it's a big team work. We have a fantastic group of highly specialized nurses, social workers, dietitians. We have primary care providers who specialize in psychotherapy and palliative care to complement that treatment. So that's what's happening here in the clinic. We have pharmacists who educate patients and their families on what's actually going to happen in the chemo chairs. So it's a big group of people who look after these patients. And this space is really important because patients spend a lot of time here, sometimes years, as they go through their cancer treatment journey.
Yeah, and you know, with Split the Pot Lottery, like we mentioned a little bit earlier this morning, you know, yes, there is government funding for our healthcare systems, but it doesn't cover everything. So where does the money go for the hospital, and then specifically where would it go towards in oncology? Right.
So a lot of things you see and touch as a patient, whether it's a treatment chair or a diagnostic tool, would come from donor money. So we highly rely on that, but also on perhaps creating a healing environment for our patients. So it could be a treatment room and making that a more healing environment.
For sure. And I mean, you've been here for a number of years, which is incredible. So you've been able to see the kind of growth.
Yeah.
You know, what is that impact, and what is the atmosphere like here day to day?
So it is a very busy clinic. We see up to 100 patients a day.
Wow.
It's hard to imagine. It's not the hugest space, but really it's a well-oiled machine, and coordinated by our fantastic people at the front desk to make sure that everybody gets seen. There's no delay in care. In fact, we're very proud that we see people in a very timely fashion. Yeah.
Can you tell me a little bit about an exciting partnership that is actually new that just happened? Was it this week?
Yeah, just early March.
Okay.
So we're very excited. As you can imagine, cancer care is a very teamwork approach, and we have many partnerships, but we recently joined the Princess Margaret Cancer Network and became partners with them, and it's really excited. Yes, because what that means is that we may have preferential access to clinical trials, an e-consult service, but also other services for patients and their families, like survivorship programs. And the other part of that is education to our nurses and pharmacists around chemotherapy. So it's a really, really exciting partnership that basically means that patients can stay here in Richmond Hill, get all the care they need while still having access to top-tier medicine.
Right, and I mean, that's huge, knowing that you come to a place where you're probably quite scared or shocked by the news, that you're going to have an army of support and options everywhere that you go.
And you don't have to travel. Like you don't have to travel.
You can stay in your community with your family, with your support system, and not have to worry about that. One less thing to worry about, for sure.
Yeah.
Thank you so much, Doctor.
Problem.
This has been amazing. We're going to continue our journey. Don't forget to get your tickets and support at splitthepot.ca. I'm really learning and getting to understand the impact that this hospital, as well as Cortellucci, has has on the community, of course. So we're going to continue our journey. I'm with Dr. David Weisman, who is the Chief and Medical Director, Department of Surgery.
Hi.
Dr. Weisman, it's great to be with you this morning. Good morning. So tell me what room we're in right now.
So we're in one of our endoscopy suites here in the Orlando Ambulatory Surgical Care Center. So this is where we perform upper and lower endoscopy, gastroscopies, colonoscopies, which we use for treating ulcers, for diagnosing cancer, for removing polyps in the colon, and taking samples. So both diagnostic and therapeutic types of procedures.
Absolutely, and I think everyone can say that they've done something like this in their lifetime. I know I have for sure, and I have family members that have as well. And a big part of this, correct me if I'm wrong, doctor, but is technology and the access that you have to it to perform these procedures.
Correct, yes. So all of our equipment is state-of-the-art, but the equipment has a certain lifespan, and so we're constantly having to upgrade and purchase new equipment, and so we always rely on generous donations to keep that technology going.
Absolutely. Can we talk about or see some of the technology?
Sure, yeah, sure. Come on in.
All right, come on in. Let's have a look. What are we looking at over here?
So this is a colonoscope.
Wow.
Some people may have had colonoscopies before, so this is a fiber optic scope, which I'll turn the lamp on. We use to insert, and
wow.
Obviously we have a patient here, but this goes up into the colon, and we can look for polyps, which are precursors for colon cancer, and polyps can be removed, and so colon cancer, which is preventable, can be treated through colonoscopy by early detection. So you can see here, this is our scope, and we have these dials that we use to
wow.
move around. This is our processor we use, where we can set to insert air, and we have our lamp. And then down here, we have our energy device. So if we do find like a large polyp that we are worried about bleeding, we can use cautery to remove it.
Wow.
Or we can use it to stop bleeding, either in the stomach or the colon. And so, yeah, a lot of different capabilities with that. Just one other newer technology that we're really proud of having, again, a lot of this has come through donation, is this instrument here. It's called a GI Genius, which is actually a new technology that uses AI to help detect polyps. So
wow.
You can kind of see, I don't know if you can see on the screen,
oh,
if I
yeah.
can turn it on, that little green box.
Yeah.
So basically, it detects any subtle elevations in the lining of the bowel, so it can help detect polyps. So it thinks my finger might be a polyp, so it's lighting it up. So it's just one other tool that we have to help detect polyps, and which can be removed, and again, potentially prevent colon cancer.
And that's huge, as we know. That's very, rising cases. That's very common. And when do people, when should you start scheduling these colonoscopies and doing this?
So for average risk patients who don't have any symptoms or family history, the current recommendation is to start at age 50. But anytime you develop any sort of symptom, like a change in bowel habits, bleeding, abdominal pain, you should always bring that to the attention of your family physician and potentially be referred for colonoscopy.
Absolutely. Well, thank you for that reminder. Now, Split the Pot lottery, like you mentioned, these donations are so important. The support is so important to the community, to this division that we're learning at Mackenzie Health in Richmond Hill today. How busy is this unit, Dr. Weisman? What would this money and this support go towards?
Yeah, so we have a very busy unit here. We are very lucky to have this space with the opening of our Cortellucci site, that we're able to take over this space for ambulatory procedures. So at any given time, we have 6 endoscopy suites working. So there's 6 physicians back and forth doing procedures. In each room, there's usually about 14 or 15 elective patients per day, plus we have emergency patients who are admitted.
Right.
So there's a lot of activity, and again, with wear and tear of the equipment
and the advancement of technology, like you mentioned, as well.
Exactly, yeah. So we're very, very grateful and reliant on generous donations from the public.
Absolutely. All right, everybody, that's a reminder. You can get your tickets at splitthepot.ca, to get your tickets. The early bird deadline is tonight, so definitely get that in. The support goes to a number of hospitals around Ontario, and again, places like here at Mackenzie Health in Richmond Hill. I'm all scrubbed up, and like you mentioned, I'm at Mackenzie Health in Richmond Hill this morning, and we're talking about how Split the Pot lottery really impacts hospitals across Ontario, and specifically here if you choose to donate here. So I'm going to call in over here Dr. Michael Cogan from the Division Head Urology at Mackenzie Health.
Hi.
Dr. Cohen, so nice to see you.
Nice to see you too.
Thank you for inviting me in here
my
today.
pleasure.
I'm going to be on. This is my first time in here.
Yeah, it's this is our operating suite, our minor operating suite, and we when our women and children moved over to Cordalucci Vaughan, this was offered and created actually as one of our solutions to the wait times that we've been fielding over the years. And after COVID, that was particularly challenging, and so this has really helped us to get our wait times down. And a lot of the equipment you see in here, as I think Dr. Wiseman alluded to, is donated by gracious patients and different groups. And so this whole area, this whole area and all of the suites and procedure rooms, we were able to really increase our volumes as a result of gracious patients and a sizable donation from the Orlando Corporation as well.
That's fantastic. And alongside the actual space, there's technology in here that you have access to as well, right? Tell me a little bit about that.
Yeah, so this is a thulium laser, and we're very excited. We were one of the first hospitals in Canada to actually have this technology.
Wow.
Again, donations have made this possible, but this lets us, so lithotripsy is the treatment of kidney stones, so we're now able to treat much larger stones without having to make incisions.
Wow.
Soft tissue is for cancer treatment. And in about a month, we're starting a new program. So I have a really interesting story with a patient who had a lot obstruction and needed drainage, and so he needed an open operation. And I expressed my frustration about the fact that there are better ways to do this.
Right.
And he actually said, "I'm going to help you, and I'm going to donate." And with the assistance of the Paul Helliwell Foundation, we were able to start a program in about a month where we're going to be able to do the same operation, but as a day surgery. Patient goes home, no incisions, and it's using this thulium laser and a morcellating device as well. So we're very excited to be starting that. We'll be, I think, the 4th hospital in Ontario doing that.
That's huge.
Yeah.
That's
for patient care. There's just anytime you can convert an open operation to a day surgery type of procedure, it's a win for patient care.
And when you have done that in the past, what does that look like for the patient? Like how does that really paint the picture for how that really impacts a patient coming out of here?
So this patient did really well, but
Yeah.
he required 3 days in hospital, an incision, about 10 days afterwards with a drainage tube. Afterwards he recovered, he did great. But the opposite is the way we'll be doing in the future, which is same day surgery. Catheter comes out the next day, and the patient can get on with their life. And this is really entirely from gracious patients and donations. And I think the important message is that we're doing this in the community. This is care close to home. It's a real, we're doing really high tech and forward thinking things. You don't have to be downtown to get that type of care.
Right, and I think that impact on the community is huge, which is why we're telling everybody to buy their tickets. Splitthepot.ca, get your tickets. The early bird deadline is tonight, and like I said, you have the chance to win, but then also you're supporting healthcare across the province, and specifically in your community.
Absolutely.
That you're affected by and touched by every single day. Yeah. You've been here for a number of years. How have you kind of seen that impact happen before your eyes even?
So we have a lot of programs that really have moved forward as a result of the generosity of patients, and all of them are really focused on getting care close to home, reducing wait times, trying to get people done as quickly as we can, and also really trying to make the patient care experience better. And I think that's the goal of all of our physicians, and we have I'm proud that we have such a highly trained group of physicians and surgeons.
Absolutely. Well, it's been such a pleasure to be here this morning with all of you. Thank you so much, Doctor. Appreciate it. Everyone, get your tickets at splitthepot.ca. The early bird deadline is tonight. Best of luck to you.